Dhaka, Bangladesh has one of the largest urban populations in the world and is getting bigger, much bigger, every day. Using the urban poor here in Dhaka as our case study, the two health systems building blocks that we'd like to discuss now are the need for good governance and adequate human resources to ensure a well-functioning healthcare system. I have with me Professor Priya Gulati, who is a visiting faculty member at the Center for Urban Health and Equity at Brock University, Bangladesh. So Priya, tell us, why the emphasis on the urban space and the urban poor?
Thanks so much, Jeff. So for the first time in history, the majority of the world's population live in urban areas, with a projected growth of 60 million urban residents per year. We're seeing a shift from rural agricultural lives into cities of an unprecedented number of people. Approximately a third of the world's population will be urban, and this is going to have an impact on everyone and on everything that we do. So we have to figure out how to address it. Unmanaged urban growth is associated with rising social and economic inequities that benefit the well-off in the form of cheap labor, but negatively impact the health and well-being of the poor and disadvantaged. Urbanization is also taking place in a very challenging external climate where there's a lack of funds. Now, the growth that's occurring is primarily occurring in developing countries and amongst the urban poor. The challenges of the urban poor are complex, and they're different from the rural poor. They're often invisible, unrecognized populations. They don't have a voice in the political process. So the large majority work in the informal sector, such as the garment industry or as domestic servants. They have very limited access to social services. Slums are often located in the most undesirable of locations, like we're in now, close to garbage, flood-prone areas, steep mountainsides. And all slums are not the same. Some are on public land or private land, some are close to water, some are not. And people come to slums based on the kind of employment they do, so whether it's the garment factory or domestic work or so on. These are areas that have very limited public services, limited infrastructure, water and health services. And health, education and other development-related indicators among slum dwellers are often compromised as a result. If we address this well and manage this well, cities could really be hubs where everybody benefits and economic growth can really happen. And this is really something that we have to look at with respect to cities that have a newly growing urban population like Bangladesh. So in Bangladesh, it's an explosive urban growth. 35 million, a fourth of the population live in urban areas right now. Half of the population is expected to be urban by 2030. Dhaka is the world's fastest growing megacity. The city size has doubled between 1990 and 2005. There are over 1,000 migrants a day. These are mainly poor. And the rate of urban growth is about 3.5%. By 2020, it is projected that a third of the urban population will concentrate in slums. So currently amongst the urban poor population, studies have found that there's a lack of adequate drainage or sewage facilities. This is particularly important in a place like Bangladesh that is subject to seasonal flooding. The urban slum is a breeding ground for infectious disease outbreaks, which means it doesn't just impact the urban poor, it has an impact on everyone. 22% of the poor urban settlements in Bangladesh lack or have insufficient access to drinking water. A fourth have no toilet facilities. 57% have no drains, and a striking 79% have no solid waste collection services.
And this brings us to the need for strong leadership and governance at all levels. Governance, as we saw earlier this week, is one of the key components for a well-functioning health system. The need for good governance is especially important in health because of the following issues: production of global public goods, especially knowledge-related goods, management of externalities to prevent and mitigate the negative health effects originating in one country and affecting others, mobilization of global solidarity, mostly through the provision of aid, stewardship to provide overall strategic direction to the global health system so that all other functions can be performed adequately, including working cross-sectorally and ensuring accountability. Priya, Could you tell us a little bit about governance, particularly within the context of the urban poor?
You're absolutely right, Jeff. Global health is increasingly the product of cross-sector interdependence. And this is much more important within the urban space because people are concentrated in much smaller areas. And we really need various sectors to be working together in creating policy and implementing programs. So we need to also then have mechanisms in place to ensure accountability of all the actors. Now, governance can be described as agreed rules, norms, and institutions that collectively promote and protect health. So it's a process of collective decision-making, and these can be both formal and informal. The informal plays a really critical role in the urban space because the pace of growth in many countries has overwhelmed the government capacity to regulate, plan, or provide basic services, especially to the poorest. So in Bangladesh, for instance, all activities urban, including the provision of urban primary health care, has the status of a project. And this has been delegated to the local government division under the Ministry of Local Government, Rural Development and Cooperatives. And when you take a look at their website, urban healthcare doesn't really figure in its list of functions. So in turn, this entity has divested its responsibility for urban health to local government bodies. And lacking capacity, this has then further got delegated to the municipal level. The municipal level, also lacking capacity, has delegated this to the non-governmental organizations. So additionally, the urban political culture is often characterized as one of money and muscle. So we talked about the urban poor lacking a voice. So votes are often bought, and there are few mechanisms in place to ensure that the local leaders are accountable to their constituents. So in the absence of strong governance, and in most cases lacking legal rights to services, the poor urban dwellers are forced to rely on informal providers or the private sector in their efforts to procure water, basic hygiene and sanitation services, and healthcare. And this makes them extremely vulnerable to manipulation, malpractice, extortion, and even violence. And it's within this context that the private and the informal sectors have emerged as very influential players on urban health systems. And yet, the state mechanisms to hold them accountable to standards of care or equity of access do not exist. And without any coordination between these various service providers, the duplication of services is rampant, and the large majority are delivered without consultation or knowledge of what the community needs and what their priorities are.
That brings us to another important building block, namely human resources for health. People, as you have already discussed, are at the center of health systems, whether in the role of a consumer of healthcare or a provider of healthcare. Ensuring that we have sufficient numbers of well-trained health workers across all of the domains is critical. One of the major challenges that we are facing globally is the insufficient number of well-trained health workers, especially in areas of greatest need. Can you tell us more about that in the context of the urban poor?
So for instance, Jeff, only 26% of the slum residents in Bangladesh are receiving qualified medical support, compared to 71% of non-slum dwellers. So that indicates a maldistribution of health workers, which means that there are health workers in the serving the richer neighborhoods, but insufficient numbers serving the urban poor. And again, we have to also think of, do we have health professionals with the right skill set? So do we have sufficient numbers of doctors, nurses, but also public health professionals, midwives, and paramedics? And most importantly, we have to ensure that people have the right quality of training, so that we can make sure that the poor are getting good quality services. Given the inadequate supply and the greater demand for healthcare, it has led to a burgeoning of informal health providers. For example, pharmacists. And when you do interviews with people in the slums, the first stop is a pharmacist. And the pharmacists are often people who have their stops right next door, and people trust them. And they may be providing a very important service given the lack of qualified and trained healthcare workers in the area. And that behooves us to ensure that these pharmacists or unqualified doctors that people are going to receive the correct training and that they know when they should refer people on to the proper hospital services that they need. So as you can see, addressing issues of urban poverty are critical. They're critical at the national level and at the global level. Urbanization, if well planned and managed, has the capacity to fuel economic growth. But if unaddressed, it's likely to result in an explosion of problems, particularly health.
Thank you so much, Priya, for taking time out of your schedule to meet with me today. If addressed, and strategies and efforts put in place to manage this well, cities could take advantage of all of the benefits of urbanization. And it's especially true in countries where urbanization is a relatively new issue, such as here in Dhaka, Bangladesh.